To Go Local Live, I'm Josh Fenton, CEO and co-founder. A lot of news today. First and foremost, today is probably Governor Gina Raimondo's last day as governor. The United States Senate, somewhere around 2 to 3 o'clock today, will take up her nomination, and in all likelihood, they will overwhelmingly approve her nomination to be U.S. Secretary of Commerce. Then a little bit of paperwork has to be done. That document has to be transmitted to the White House for signature by the President of the United States. Sometime later today, she will be sworn in as Secretary of Commerce. She will resign the governorship, and there, Dan McKee will take the oath of office and become Rhode Island's governor, at least for the next 21 months, and maybe far, far beyond. So lots of things going on there. Secondly, if you haven't seen it, yesterday we broke a GoLocal film on the governor's handling of the virus. If you haven't seen it, take a look at that. And third, breaking late this morning, was a press release from Mayor Jorge Elorza's office about how certain people who live in certain zip codes will get prioritized. Let's go to Dr. Michael Fine and talk about that. Dr. Fine's the former Director of Health for the state of Rhode Island. Dr. Fine, thank you so much for joining us.
Great to be with you, Josh.
So let me set the stage. The Mayor Jorge Elorza and Council President Sabina Matos sent out a press release saying, listen, if you're over 50 and you live in 3 zip codes, 02907, 02908, and 02909, you get to jump the line. You get priority over people who live in the rest of the city, and you should sign up right now for notification of when you can be vaccinated. And the reason for it was that those folks would be at higher risk, a justice issue. They would be living in 3-deckers. They might be working in places where there's a higher degree of spread. There's just one problem with it. I don't know if the mayor or the council president bothered to really take a look at how big zip codes are in the city of Providence and who it includes. So let's talk about who it includes. It includes some of the ritziest apartment complexes in the state of Rhode Island. The Promenade apartments that can go for as much as $3,500 a month with indoor pool, private gymnasiums, concierge service fall into that 02907, and that's not the only facility that falls into that category. So people who are amongst the absolute wealthiest, predetermined by the mayor and the council president because of the zip code they live in, go to the front of the line. While the idea was nice, the execution seems extremely poor. Your thoughts?
Well, the idea is nice, and you really want to get to everybody over 65, first over 75, then over 65, then over 50, and get them vaccinated as soon as you can. People who live in densely populated communities, people of color, are at greater risk, and we want to be able to get them vaccinated quickly to protect their communities. The challenge is the data, essentially, that guides you to getting to the people at highest risk first, without taking a broad swath and getting, groups that you maybe didn't intend. Remember, we're a country without a healthcare system, so we don't have a list of everybody over 65, who meets certain criteria, who we can call up and say, please come and get vaccinated. We're doing pretty broad swaths, and you're gonna miss the mark sometimes. The good news is we're pushing getting people vaccinated. We're getting close to 20% of the population of the state. That's a great thing, but getting it done exactly right and in balance is really tricky.
Is it really that tricky? I mean, this is one of those things that just dumbfounded. It's not like the only delineation of where people live by wealth and race is determined by zip codes. Actually, that's not even a real delineation. It's census tracts. And census tracts, and let me just finish. Census tracts, Mount Hope section of the east side, Camp Street area to North Main Street. I used to represent it on the city council. It is gentrified quite a bit since I was on the council, but it's still a predominantly black, lower income neighborhood. That is an area that should be identified and should be prioritized. The case of US Rubber Lofts, the 903 apartments, the Promenade apartments, which are overwhelmingly white and overwhelmingly affluent, being prioritized is an example of no work being done. This is just over and over and over again. It's not like we didn't know this was coming for a year, and it wasn't like we didn't know we were going to vaccinate people, but we are still just throwing, I will use the term crap around, much of it for press purposes only, and it's not for purposes of public health. If you're saying, listen, let's identify people who are at the most risk, and folks of color, Black and Latino, are the most at risk for socioeconomic reasons, for racial discrimination reasons of where they live, 100%, I understand that prioritization. But to say, we can't spend 5 minutes figuring out, we're just gonna do it by zip code, let the party begin, makes no sense at all.
Yeah, but I got to go back to the notion of us not having a healthcare system. I mean, like, you're right. We should have done this years ago, but we should have made a healthcare system years ago. This is kind of no way to sail a steamship. We're sort of blundering around because of what we don't have, and we don't have any kind of way to think in a population-based way that's sophisticated. I've been saying for years that Rhode Island needed to have a single electronic medical record and assign every single person to a primary care practice. I mean, if we had done that 20 years ago, we'd be light years ahead of where we are now and be prepared for what we're dealing with now. But we didn't do that. We didn't do lots of things. And we paid the price in the United States with 500,000 lives, and in Rhode Island with 2,525 lives as of today, and it's going to get worse. And what I don't hear, Josh, is outrage not just about the presence or absence of who we prioritized when. What I don't hear is outrage about our lack of a healthcare system and a coherent approach to health services generally. We pay the price for that every day in lives. We pay for it in money. It costs us twice what other countries pay for healthcare. And what we don't have is people, sort of screaming about this and in a hurry to fix it.
Yeah, but let me just break it down. I can't fix the fact that we have no healthcare system, either in Rhode Island or across the country. I could, as governor of the state of Rhode Island, issue an executive order that says I'm going to allow the Department of Health for these purposes to look at all health source data. Okay? And at Health Source, we have a lot of data on where folks, especially moderate and lower income people, live. And we're going to look at that data and we're going to come up with some strategies to be able to identify where they live and get them vaccinated, those most at risk. Instead of brainlessly brainlessly saying, let's do zip codes.
Yeah, well, I mean, we have something called an all payer claims database, so that we actually have a database of all claims that are filed, all insurance claims that are filed all together. So we actually have built some of that infrastructure, but we don't use it. Same thing's true of Medicare data. We know I don't know who the we is. At CMS, they know everybody over 65. Have we used it in this way? Well, those people over Medicare are getting emails from Medicare saying, go and get vaccinated. But that's a whole different thing than when somebody, goes neighborhood by neighborhood, house by house with a list of people who need vaccinating and either calls them or knocks on their door and says, here's a vaccine, let's get you a shot. That's the way to get this done. That has started in some places. I mean, they've done high rises, elderly housing in Providence and in Central Falls. And I think are beginning to do it in Pawtucket. That's a good thing, but that doesn't get us to the large number of people who don't live in high rises, who live in neighborhoods, who need a knock on their door or a visit from somebody they know and trust.
Well, at least those Department of Health folks can go over to the Promenade apartments, knock on the doors, right? Because they're a priority, bang on the doors. And when they get a little tired, get a juice at the snack bar over at through the concierge service, or head over, get refreshed in the indoor pool. Has a retractable roof. It's quite beautiful, and there's a gym there, and they can get a workout in. So I think they can cover all the necessary items while they're laying out this program. I'll leave it at that. Dr. Fine, let's jump over to where we are with the virus and some of the narratives that are going on. Last week, Governor Baker announced that on March 22nd, I believe it is, he was a very significant expansion of the reopening, including football stadiums, baseball stadiums, indoor sports arenas like the Garden, et cetera, and that a certain portion of fans could reattend. We've gotten the virus down. It's not record low. It's nothing like it was in July. And there's a lot of virus out there, and there's clearly concerns at the CDC that we're going to blow this thing, that the governors who are reopening things are making a terrible mistake. And is this actually the time, if we want to have a great summer, if we want to really try and beat this thing while we're getting vaccinated? I know it's counterintuitive, but isn't this really the time not to go hog wild reopening things, but actually be as disciplined as we have ever been to compress the amount of cases so we don't have spread of the variants, so we can beat this thing and actually have a great summer?
Yeah. I mean, what you heard from the CDC is exactly right. This is not the time to open anything. If anything, there's a moment where if we got tighter, and we really got worked it really hard for a couple of weeks and really got the virus under control, and really under control. That means, making sure that we're getting as many people vaccinated as we can, making sure that we're testing every single person who's not working in their homes and staying home. Anybody who's in contact with the public, if we could build the infrastructure and start testing all those people twice a week and moving anybody who's positive into quarantine, into isolation and quarantining contacts, this is the moment where we could actually get control. You've heard me be cynical about testing. This is the moment we need a sophisticated approach to testing combined with good social distancing and better masking. If we did that, I think we can create an economy that leads the country. And if we don't, we're going to have another messy summer. I saw some information from, Chambers of Commerce and the Hospitality Association saying, we need this, this, and this so we have a great summer. And I think they're missing the boat. We need to be really working hard now on the virus, really hard, getting really good control of it. And then we become the safest place in the country. And then everybody wants to come here for vacation. And we have the best summer we've ever had.
Yeah, I mean, literally, who wants to go out to lunch or dinner when it's 19 degrees and the wind's howling at 50 miles an hour? I mean, keep it closed today. I want to go to Newport this summer. I want to go to the Jazz Festival. I want to go to, events. I want to have shared experiences again. It seems like this is the time. And I got to say, we're easy to criticize Trump. Where's the White House on this, on discipline, on, stepping it up? This White House is great about talking about vaccines. We're vaccinating, I guess, about 1.8 million a day. And most public health experts say we need to be doing 3 million plus a day. So,
and even so, we become a one-trick pony, thinking only about vaccination. And vaccination by itself is going to help, but vaccination isn't going to get there. What the director of CDC knows, and what I think I know, is that, according to surveys, likely only 70-ish% of the population is willing to get vaccinated today. If we hit a plateau in vaccination in April or May, and 30% remains unvaccinated, then this virus is going to circulate with intensity, likely over the summer, if we don't do something else to stop it. That's where we need to up our game now. And the upping our game is not just support of businesses, which is important, but it's really working hard to control the virus, because when we get that done, we can really open things up then without fearing that we're going to have to close them intermittently here and there, so that everybody's afraid about which state you can go to and who can do what in what state and where you have to quarantine, all that kind of stuff. We can get past all that if we do our job and do it right today.
Uh, Dr. Fine, what do we need to do next?
Oh, well, obviously we have to keep up vaccination as much as we can. We need to build a very coherent testing strategy, very coherent, so that anybody who works outside of their house is tested twice a week, and that somebody bugs people until they get that done. We need to really hammer on masking and social distancing. And I think the thing we really need to do is adopt a target. I say 2 cases per 100,000 per week. That's a very conservative target. I mean, 2 cases per 100,000 per day. Maybe it's 5, but somewhere between 2 and 5. And then I think we need everybody to focus on that target. We need to know what the number is and need to be working hard together till we hit the number and keep that number stable for a week or 2, maybe 3. When we do that together, when we focus together on that critical number, then we really have a place to stand and a place to go together.
Let's talk about that number for a second. On your high side, it's 5 cases per 100,000. That is a number that functionally Rhode Island has maybe only been at 1 time, 2 times, July 2nd and July 3rd, I want to say, around
Yes.
there, where we had sort of 30 and 40 new cases on a weekly basis. So you're allowing for a little higher because it's per 100,000. But we're talking about below, well, that's it. That's what you're talking about.
Yeah,
That's
yeah.
it for
If remember, at that number, we can meaningfully isolate everybody who's positive, and we can meaningfully make contact tracing work, and make quarantine work. Up to that number, we're chasing our tails. And the one thing I don't think I was clear enough about was not only do we have to get to that number, but we have to get to it with robust testing. I'm saying 20,000 tests a day, maybe more, but in the range of 20 to 50,000 tests a day. That's the number of tests we need, at least for a while, to make sure that we're actually at that low number. And we have to be much more sophisticated than we have been so far. We need to segregate symptomatic and asymptomatic testing and make sure that anybody who's symptomatic not only gets tested, but gets tested with PCR and with DNA sequencing, so we know about any variants that emerge or any variants that are spreading and can work to contain them. That's the kind of science that we need to make this work. We have the science, but we need to apply it, and for the first time.
Dr. Fine, you get the last word.
Well, this is really the moment to go the distance. This is not the moment to back away, and this is not the moment to assume that everything's going to be okay. We are better than we were, but around the country, we're seeing evidence of an increase in number of cases. We saw some evidence from Rhode Island. We need to really put our noses to the grindstone, and make sure we do the work that's needed to be done to get this virus gone.
Dr. Michael Fine, thank you as always. For everybody else, stay tuned. We'll continue to track the transition of power from Governor Raimondo to Lieutenant Governor McKee. We should have a new governor tonight in the state of Rhode Island. The two couldn't be any more different from personalities and approaches to government, just about everything else. It's amazing they're in the same political party, but everything's a mystery today in American politics. So we will be entering the McKee era shortly, and it will be a very different state of Rhode Island from the State House standpoint. Stay tuned on updates on that. We'll have that coverage all the way into the evening. For everybody else, please stay safe and wear your mask. Do everything you can. Numbers are at a lower, much lower point than they've been. It's been because people have put in the time and effort. It's the time to be extra, extra vigilant, and hopefully we can make it through this spring without a third wave, which would be a crushing blow, both to I think our mental health, our physical health, and Rhode Island's economy. Do everything you can. Thanks so much, everyone.
Thanks, Josh.